Hey guys, and welcome to today's video about osteoarthritis. Osteoarthritis can be split into three words: osteo, arthro, and itis. Osteo means bone, arthro means joint, and the prefix itis means inflammation. Bring them together and you get the literal definition of osteoarthritis: bone, joint, inflammation. A concise definition would be that osteoarthritis is a degenerative joint disease that prevents smooth movement. A joint is where two bones meet each other. A healthy joint is one with a layer of cartilage that acts as a shock absorber, with synovial fluid providing lubrication and the necessary nutrients required for it to remain healthy. So how does an osteoarthritic joint present? The patient may initially describe the pain as a sharp ache. They may also state that they feel slightly stiff in the morning, but only for under 30 minutes. Another symptom to look out for would be that the patient states that prolonged activity actually increases the pain. However, the pain decreases upon rest. In addition to those subjective clues, you may notice swelling, redness, or an increased temperature at that particular joint. James Syriac, known to some as the father of orthopedic medicine, developed an idea called Capsular Pattern, which describes that following osteoarthritis, the joint will exhibit restrictions to certain movements. For example, some of the first movements that may be restricted in hip osteoarthritis is flexion, internal rotation, and abduction. I would not use Capsular Pattern solely as an indicator of osteoarthritis because evidence behind its validity is inconsistent, and also because each patient is unique. But it may be useful to keep in the back of your mind when using the process of elimination to determine the diagnosis. When looking at an X-ray of a patient with osteoarthritis, here are the three things you should look out for. Narrowing of the joint space, which occurs due to the degradation of cartilage and also due to the reduction in viscosity of the synovial fluid. Bone sclerosis, which is where there's an increase in bone density, which will show up as whiter compared to the rest of the bone. And finally, osteophytes, which is the presence of more than one bone spur caused in response to wear and tear. Here are some of the risk factors that increase the likelihood of osteoarthritis. Mechanical injury. About 5 years ago, I encountered an injury in the proximal interphalangeal joint of the third finger. The doctor placed a metal plate in the finger, and immediately after the surgery, he explained to me that I was going to get osteoarthritis in this joint a lot earlier on compared to the other joints. Joy. Excessive body weight. That's another reason why there's an increased likelihood of osteoarthritis, and this generally occurs at the joints where there's increased load bearing, such as the hips and the knees. A loss in strength. Anatomical abnormalities is one, such as a valgus or a valgus in the knee. Even things like my thumb. You can see how it bends at 90 degrees, and as a physio, I require this thumb to push to provide soft tissue mobilizations. However, if I perform it at this angle, it's likely to put a lot of pressure onto the joint and give me osteoarthritis a lot quicker. Not saying that this is an abnormality though. It's quite cool. And here's another myth that I'd just like to dismiss. Cracking your knuckles does not increase the likelihood of osteoarthritis. Okay, so I know what osteoarthritis is. I know the signs and symptoms. I even know some of the risk factors. But you still haven't explained why it occurs. Well, due to wear and tear and the risk factors that I labelled before. Yes, but why? Why what? Surely the human body is able to self-repair a little wear and tear. Not quite. It is generally thought that osteoarthritis is caused by wear and tear, which has some truth to it. However, scientists now consider how wear and tear, along with the other risk factors, interact with the cells in the cartilage and also the synovial fluid during the progression of OA. A healthy cartilage is in a state of balance between synthesis and degradation. However, due to the risk factors, an imbalance occurs, increasing the net production of enzymes degrading the cartilage, further progressing osteoarthritis. It's all really fascinating and it's all so complicated, but I've tried to make it as simple as possible for you guys. Hopefully you enjoyed what you saw and found what you came for. Make sure to comment, leave a like and subscribe down below. Take care and I'll see you later.